So Megan, what is the nicest thing a healthcare worker has ever done for you?
Thanks for coming. They gave me lots of teddy bears. Lots of teddy bears. I have a whole room full of teddy bears. And they made sure that they wore gloves around me. And if they were really sick, they wore masks around me. And made sure that if they dropped anything that was like on the floor or anything, they never gave it back to me or anything. And they're very protective, very protective.
So Megan was diagnosed when she was about 6 months old with severe combined immunodeficiency Omen syndrome. We had to go down to the United States. It was in 1990, and in Edmonton they didn't have a program here, and we couldn't go to Toronto or to Vancouver. They were full. Megan's disorder is similar to the bubble boy disease. It is actually the bubble boy disease. David Vetter was the bubble boy, and Megan went down to the States to have a bone marrow transplant. She was about 10 months old. Her transplant was done there, and she came back to Canada when she was 2 days shy of her first birthday.
It was also an unrelated donor.
Yes, her donor, Martha Jones, is from the United States. She's a lovely lady. We've met her a few times.
Are you still in touch?
Yes.
We are still in touch.
Oh, that's wonderful.
So it is
Emails.
wonderful. Megan's a good friend with her, so it's nice to know.
For me, treatment, to be truthful, is a lot of time consuming, but it has made me better. It has made me healthier. I can go places more, and at first I was stuck in the hospital. Every 2 weeks I had to go in for an infusion of IVIG, and it made me healthy for about 4 days of a 7-day week, and then my immune system would just crash and I'd be sick, and then I'd have to go in again, and it would go back up, but it would be constantly going down and up and down and up. And then they came up with hemoglobin when I was 17 years old, and I could do it at home, and I started with 5 days out of the 7-day week with 10 ml, 10% solution, and I was feeling better. I could breathe better, I could go places more, I could hang out with my friends, I could take as long as I wanted to infuse myself. I could lay on my bed, watch TV, and just take my time. And I could fly on planes, and I could take like a 4-week vacation if I wanted to.
That's awesome.
Yes.
They changed the Vivaglobin to Hizentra now, and even since that change, Megan's done even better.
Less doctor appointments, no infections as often, and my muscles have felt better. They do still hurt, and I have actually developed arthritis.
Wow.
Yes. But I am managing it very well. And what else? Oh, I have asthma. It acts up around smoke, perfume, some plants, molds, definitely molds, because in some houses there's lots of molds, and it can also affect PID patients. And what else is there? There's I take Ventolin and Zenhale. Zenhale's the big one. It opens my lungs up a lot. And Ventolin is only for the time when my lungs squeeze really tight and I can't breathe at all.
So
What else? Oh, I had my right middle lobe removed when I was 6 years old. It collapsed. I was up and about, and then I was sleeping for a day, and then I was up and about again, so we didn't really know. But we got back home after the vacation and found out. Pleasant. I got tons of surgeries too. Lots of sinus surgeries. I can't go around sick people. I don't touch doorknobs, tables, floors. I have to wait till somebody opens the door for me, or I can use my sleeve or my foot. And I constantly carry around Purell.
for me, to be honest, my life is totally different now. I grew up, first of all, that was number one. Secondly, I worry a lot. I'm always on the lookout to make sure she's okay. I pay attention to how she looks to me. And there's always the idea that everything has to be dropped immediately if she's very ill and I have to run to the hospital. It doesn't happen often, but there are times. So we go through periods of calm and then extreme excitement and then calm. And so it's a continuous thing. I think that the other thing that has changed for me is that I have volunteered to the Canadian Immunodeficiency Patient Organization since 1997 because it's a passion for me to help other people to connect. And I feel that if we can connect and get the idea of primary immune deficiency out there, educate people and physicians, it's helpful for public and patients to get together and understand what it means to have a primary immune deficiency. So it's a passion for me. It's a lot of work, but it is a passion.
One, make sure all your family members and friends know that you have PID and inform them really well of what the condition is. Because if you go into a hospital and you can't speak, it'd be a really great idea to have someone else that knows. And also, don't neglect the people who don't have PID. I have an older brother and we never neglected him and he is awesome.
But it's educate yourself as best you can. Try to find out. You can go to our website at zippo.ca. We have educational material there to learn about primary immune deficiencies. But have an open conversation with your medical providers. It's the best way to find out what you have and go from there.
For the ones that don't have PID, or even the ones that do, before you have kids, genetic testing would be a great and amazing idea. Because even if you have a sibling that doesn't have it, they could carry it. And then they could meet someone who carries that too. And then they could have a kid with PID or SCIDs. So that would be a real major point.